The exercises I've started for this joint pain that I've been having seem to be causing more pain. Should I continue? That is a great question, and it's a question that I get often. So for the answer to that question, stay tuned. Welcome to InjuryGuru.com. I'm Carla Schimmelpfennig, registered physical therapist. We've all heard that popular phrase, no pain, no gain. And when it comes to normal, healthy tissue, that philosophy is really accurate. Lots of us have started an exercise program, and we get that muscle soreness that you feel when you go to sit down gracefully, or when you go to walk downstairs and you have to grimace or even moan a little in pain. And that is that no pain, no gain philosophy at work. And if you want to get stronger, that's exactly what you need. When it comes to joint pain or pain from an injury, that philosophy simply does not apply. As a physical therapist, and when I treat my patients, my philosophy has always been no pain, real gain. And let me explain what I mean by that. If you are exercising or moving and causing pain to an injured body part, or a body part that you're just having pain in, you're only going to irritate and cause more pain, and even prolong or prevent that healing process from occurring. When you're dealing with joint pain or pain from an injury, you need to work the tissue, but not irritate or work that tissue beyond its limit. It really is a very fine line, and you want to use pain as one of your main guides to help you find that fine line. When I am treating my patients, I always want to make sure that I'm not giving them exercises that cause that typical pain, or that pain that brought them to me in the first place. If the exercise or movement that I give them is causing that typical pain, then I modify it in order to avoid that pain. It's really that simple. On my website, you'll find lots of exercise videos and exercise programs to help you deal with joint pain or pain from an injury. And you will hear me say very often that make sure you're exercising within that pain-free range, or if an exercise causes your typical pain, causes more pain that you've been having, then make sure you change or modify that exercise. In my 25 years of experience, that is one of the most important things that I've learned, and it hasn't failed me yet. So if you are doing exercises for an injury or for some joint pain given to you by a physical therapist or another healthcare provider, and they're causing more of that typical pain, then make sure you change or modify the exercise. And if that doesn't work, then stop the exercise altogether and make sure you let your therapist know. Remember that no pain, no gain philosophy is great, and it's accurate if you're dealing with healthy, normal tissue. But if you are having joint pain or pain from an injury, that rule no longer applies. You have to make sure that you're being good and nice to that tissue in order for it to heal and get through the complete healing phase to get back to normal, or as near normal as possible. The ideal situation is a smooth, consistent path toward full recovery. And one of the best ways to assure that you're on that path is not to stress or overwork the tissue and promote healing rather than hinder or prolong that healing process.